One of the things that I recommend that a family do as they get into their third trimester is to develop what's called a birth plan. And really, whatever it is that the family feels is going to be the best approach for them during labor and delivery and that immediate postpartum period, they should put down on a piece of paper. Some people are perfectly okay with pain medication. Some people are perfectly okay with epidurals. Other people do not want that, and they don't even want to be asked about it. If that's the case, they should write that down. They don't want to have that in their mind even. They're just going to go into it. And especially if they're doing something like hypnobirthing, they don't necessarily want to be disturbed. They want to have their plan put forward, and they'll say, hey, listen, if I change my mind, I'll let you know. But that's something you have to let people know ahead of time. But there's so many other aspects to the birthing. A lot of women would like to be able to walk around and move. Some women would like to not have IV fluids going. They'd rather be able to drink fluids and just have what we call the hep lock, the needle in there in case you need it for emergency. Some women will want to make sure that an episiotomy is only done once they're told that it's going to happen, and not just do it spontaneously. So if you go online, you'll find lots of different birth plans, and I suggest that a woman read 3, 4, 5 birth plans and put something together that works for them. So I recommend that when a birth plan is put together, print out half a dozen copies, sign it like a formal document, walk in to the nurse, hand them a copy, put one on the front door of the room, put one on the other side of the door, put one above your bed, above the baby warmer. Anybody who's willing, give one to the janitor if they're willing to take it. The most important thing is the more people who know what it is that you want how your birth to be, the more likely it's going to be that you're going to get that. And it's also nice to whoever's going to be with you, whether it's a parent, an in-law, a sibling, your husband, whoever, the significant other, a doula, they need to know what your plan is too. Because also, when a woman's giving birth, she doesn't need to have all those types of distractions. In fact, sometimes she may be in pain, or she may be just in a different place altogether with the hypnobirthing, and she may not be able to advocate for herself the way that otherwise that she would in a normal circumstance. So the more people who are aware of the type of birth that a family wants, the more likely that they're going to get that to happen. And then, of course, I let them all know, hey, I'm available. If anything comes up, there's very, very few things that you can't call time out. In 5 minutes, give me a call and we can discuss the merits of what your choices are. So I'll be there in order to help make that decision. But I mean, if there's a true emergency, of course, do whatever you need to do. But that's very, very rare that you can't call 5 minutes to figure out what you want to do with somebody. But again, the more time, the more things that are put into that birth plan, the more likely it's going to be the way that a family wants it to be.